And last thing is to do with who qualifies for deliveries from a pharmacy, but really, I want to really centre it on what is considered high risk. So, Ghulam, you're a better place to answer this because we were having this debate yesterday.
Yeah, I'm gonna find that article. Well, from the it's not an article, it's a document. Sorry.
Yeah.
Let me find it. Right. So again, I'm just going. We're receiving different guidance all the time. Every week, we're receiving communications from the local area team on what to do, what not to do, etc., etc. But I think this is kind of stayed static. So the risk groups. So generally, anyone over the age of 70, regardless of medical conditions, or anyone with the underlying condition, that what you'd receive the flu jab for, you should practice social distancing and stay at home like everybody else where possible, and just go out for your shopping or urgent medical supplies and once a day exercise, right? So, but then you've got those that are very high risk groups. So I'm just going to read them out or just summarize them. And these are the people that should be shielding. Now, I want you to remember this word shielding. Shielding means that you have to stay at home. You can't go out. You must have people deliver food to you, deliver medication to
And
you.
the guidance right now is you shield for 12 weeks.
Minimum of 12 weeks,
Yeah.
or basically until further notice, right?
Yeah.
And so this is people who come under the category of shielding are those that are very high risk groups. And you should have received a letter from either NHS England directly, who have your information at hand, or the hospital trusts, or your GP surgery. So either from one of these three places, maybe even multiple letters explaining that you fall under this category. So these are people who have had an organ transplant, such as a kidney or liver transplant, people with a cancer who are undergoing active chemotherapy or radiotherapy, people with people with cancers of blood or bone marrow, such as leukemia, lymphoma, or myeloma, people who have immunotherapy or other continuing antibody treatments for cancer, people having other targeted cancer treatments which affect their immune system, people who have had a bone marrow or stem cell transplant in the last 6 months who are still using immunosuppressive drugs, people with severe respiratory conditions, including cystic fibrosis, severe asthma, and severe COPD. You should have received a letter from your GP surgery. People with rare diseases and inborn errors of metabolism that significantly increase the risk of infections, such as when you have a genetic disorder that makes you susceptible to having infectious conditions. People on immunosuppression therapies that reduce the risk of infection. So if you have an autoimmune condition, such as rheumatoid arthritis, Crohn's or ulcerative colitis, and you're on tablets that reduce your immune response, then again, you would have probably received a letter to be shielding right now. People who are pregnant with significant congenital heart disease, all patients taking any immunosuppressive medication, so just what I said earlier, and then patients with uncontrolled or very badly controlled or just complicated diabetes. So the guidance that we received in general practice was where their HbA1c, which is a marker in the blood that tells us how good their sugar regulation has been for a period of 3 months, their HbA1c greater than 75, or someone who's had diabetic ketoacidosis, patients with COPD, chronic obstructive pulmonary disease, who have required hospitalization in the last 12 months, or who have required 2 or more courses of a rescue pack, which consists of a steroid and an antibiotic in the last 12 months. So if you've had to use that twice over the last 12 months, you go into the high risk category. Patients with asthma with a history of hospitalization in the last 12 months who have been admitted into intensive care. So if you've had an asthma attack and it's been quite bad and it's required hospitalization. Patients with significant heart failure who have required hospitalization for their heart failure within the last 12 months. So if you have to go in over the last 12 months because of your heart failure symptoms. Patients with long-term multiple long-term conditions. So my mother falls into that, for example. She's got multiple different long-term conditions, and she's quite elderly. Patients who've had their spleen removed, anyone that's taken continuous steroids to the equivalent of 20 milligrams of prednisolone or more for the period of 4 weeks or over. So if you've taken any sort of oral corticosteroid and it's a high strength and you have to take that continuously, you fall under that category as well. And anyone again that's on any immunosuppressive or immunomodulating medication, either in primary care or if you're receiving that in hospital. So you might, for example, go every fortnightly to get an injection infusion at your hospital as an outpatient. You fall under the high risk category. So it is a bit of an exhaustive list, but as you can see, it's to do with those that have very complicated conditions, or those that have uncontrolled, unmanageable, or I don't know what the right word is. But their conditions are not treated. They struggle with their long-term conditions, and those that are on medication that impairs their immune response. So generally, they're the groups of patients that should be shielding for a minimum of 12 weeks. But basically, I wouldn't even follow the 12 weeks until further notice. Stay at home. Have people drop off your shopping to you, have people drop off your medication to you, and try your best to stay entertained and safe at home. I guess it's difficult. We've had to do that. For example, my third eldest brother, he's one of his children falls under that category, so he's decided to sort of isolate, shield for a period of 3 months, and we moved my mother in with him, because it makes sense. If he's shielding, she might as well be shielding with him, because she has a type of a blood cancer which is treated with medication, and she has diabetes and other conditions, and she's elderly. But I mean, they're not normal times, and it is difficult. I understand that shielding is not something that any one of us would have thought we'd have to do, and none of us thought we'd be living like this right now. Our life has changed, but it's something that is worth it to protect lives and to obviously protect the NHS as well. So yeah, that's what it is.
It's the other thing I like to add to that is people who are shielding or who should be shielding. It's really important that they be really disciplined about this. It's hard. Even just a week of being stuck in the house is hard. But to do it for 12 weeks or more is immensely difficult. But you've got to be disciplined about it for your own sake.
Yeah.
So as you just said about getting online deliveries or getting food dropped off to you, or if people need to see you to really do it through the window, it's hard when you're having to see, say, your mother or your father, or your grandparents, but you can only really talk to them through a window.
Yeah.
It's painful for the person who's shielding. It's painful for family members who are just checking over their parents or grandparents. But for everyone's safety and for us to be able to get over this difficult period, these are the measures that we all have to do. And
no, it's very difficult. It's not easy, and there are support lines that have been developed to support people emotionally during this period as well, because obviously it's going to have an impact on your mental health. But your local GP surgeries will have all the support groups, both for practical support in terms of for groups that are helping with shopping, helping with medication drops, and also any other sort of support that you might require. So if you call your GP surgery, the reception will have the details of all these different groups. So don't feel that you're alone. I'm isolated. I don't know what to do. I have no support. I have no family that can help me. If you fall into that situation, there is support out there for you. Just make sure that you call your GP surgery. Sometimes your community pharmacy will also have these details at hand, and they'll be able to help you and signpost you as well. And if you need any, if you are shielding, deliveries to you should be free of charge by your community pharmacy at this moment in time anyway.
And there's another thing here as well that you touched on everyone's mental health and their well-being, because it is a stressful and difficult time for everybody.
Yeah,
But we can all make more of an effort. And I think we have been. I think one of the really nice things that I've experienced, but also seen from others and heard from others, is how we've made an effort to be able to connect with others. So I have a great uncle who's having to shield. It's not too far from me. He's only in Rochdale, but uh, I want to make more of an effort just to check up on him.
yeah, yeah,
And because I know shielded, would I have been as stringent on trying to be in contact with him before this?
mm,
Possibly not. There might have been times when I thought, oh, I'll speak to him later, I'll speak to him another time.
yeah,
I feel as if I should make more of an effort.
yeah,
I've made more of an effort to have video conferences with friends which I haven't seen for a long time.
yeah. I mean, that's been the great thing about
But
it.
yeah, it's funny. We're being pulled apart, but we're also making more of an effort to be connected in one way or another. So out of all this craziness, it's quite a nice, beautiful thing that's sort of come out of it as well.
Definitely, and I wouldn't even just restrict it to family. I mean, my
Yeah,
neighbours have been great. They've been sending messages to each other saying, "Do you need anything? If you're isolating, let us know. We could pick up some shopping when we go over, get some
yeah,
extra items for you." So, utilize your neighbours as well, because everyone's in it together. Everyone understands the situation we're in,
yeah.
and it's been really great, sort of that community camaraderie, and and I hope once this is over that continues as well. And I think there's going to be a fresh outlook to life, and we're going to all assess our priorities, and we're going to appreciate things that we never really appreciated or appreciated enough previously.
I hope so. In the past 3 years, the country's been torn apart, communities have been torn apart, families have been torn apart with Brexit,
Yeah,
those sort of discussions. And it's took a global pandemic for all of us to sort of be a
yeah,
bit more aligned together. And
yeah,
there's some good things that have come out of this as well. Take the horrible stuff aside. There's been some really nice things that we've all experienced and witnessed and felt, and
yeah,
important that we take that on board into our normal everyday life, whatever normal will be after the back of this.
yeah, definitely.
Cool. All right, I think we're pretty much done.
Anyway, let me double check the we haven't missed anyone. One moment.
Yeah.
I don't know. We've answered that. We've answered a lot through discussion, haven't we? Um,
Yeah, no, I think that we touched on a lot, and I think we touched on things that we weren't expecting to on this as well.
yeah.
Yeah,
How do I qualify for a delivery? Did you answer that?
that's all. Call your pharmacy. They'll
Yeah,
they'll
yeah. We've received guidance on deliveries recently. So yeah, if you call your community pharmacy and if you have received a letter for shielding, you'll be automatically entitled to a free delivery. And if you're above a certain age and you've been asked to isolate anyway, where possible, we'll be able to sort of undertake that delivery for you as well. That's it. And what should I do if there's an outbreak in my community? I think it's the last one. It depends what they mean by community, don't they?
yeah, not too sure. Anyway, if that happens, stay at home.
Yeah.
Okay, we've got to wrap this up now. Thank you to anyone listening. Thank you, Ghulam. And if you're listening, I hope it's been useful and you've been able to take some bits of information that are going to benefit to you. Thank you very much. Bye bye.
Thank you. Bye.